Well, Oklahoma is set to become the latest state to pass a near total ban on abortion procedures. House Bill 4327, as it's called, is waiting for a vote in the state Senate before making its way to the governor's desk. If signed, it would be one of the strictest anti-abortion bills in the country. NBC News Now correspondent Maura Barrett joins us now from the State House in Oklahoma City. Maura, good morning. First, walk us through exactly what is in this bill and what are both sides saying about it.
Well, Vicki, this bill would ban all abortions right after conception, with the exception in 2 cases: if the mother's life is at risk or if the pregnancy was a result of rape, sexual assault, or incest, and those incidents have been reported to law enforcement. And so, as we know, there's a lot of hesitation from women about reporting those kind of incidents. So this is going to limit abortions extremely to an extent that we haven't seen before in other states. And so anti-abortion activists are really excited about this. They're calling it a win, and they're already mapping out their strategy state by state as we look at Roe v. Wade being reconsidered by the Supreme Court this summer. But meanwhile, clinic providers, healthcare providers that conduct abortions are saying that this is just overwhelming facilities, and it also just forces women to travel to states where abortion is allowed. And this means that it's only becoming available to people who can afford to travel, get childcare if they need it, take time off work. And so it's really just forcing women into a more unsafe procedure if it's limited in their states. And so this is something that is on the table here in Oklahoma, but it's also one of at least 7 other bills right now in the state.
That was my next question. Just last year, we talked about Texas, which is right next to Oklahoma. They passed a near complete ban on all abortions in Texas, and that is having a serious impact on medical providers as well in those neighboring states, not to mention the women, as you mentioned, who will now have to travel to get this procedure. What are you hearing from healthcare providers about the rise in patients who are crossing state lines? You know, what kind of effect did the Texas law already have there in Oklahoma?
Well, the Texas law was passed back in September, and since then, Texas saw a 60% drop in abortions. But data from the University of Texas at Austin shows that 1,400 women a month left the state to get abortions elsewhere. That's 12 times more than the abortions that were happening before. And they're going to places like Oklahoma, half of them, in fact, coming here to Oklahoma. And these clinics are just overwhelmed. I want to hear from the medical director at Trust Women Clinic that we spoke to here.
In Kansas and Oklahoma, we're kind of living in what is almost like a post-Roe environment. The sheer volume of people is remarkable. We've had to adjust our phone systems, adjust how we schedule people, adjust our patient caps, and also really pace ourselves for sustainability. We could truly be providing abortions 24 hours a day and not meet the needs of people who already access our clinic.
Now, some states are working to combat this state-by-state approach. Colorado, for example, just passing a bill that protects the right to abortions in the state, which would give the ability for people to safely travel to Oklahoma, or to Colorado, for abortions in restricted states like Oklahoma or Texas.
Maura Barrett with an important fight there. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.